my name is Jeannie Hoffman. I'm a rehab psychologist here at the University of Washington, and I'm the director of the Northwest Regional Spinal Cord Injury System. We are very pleased tonight to welcome Dr. Juana Sanza, who's an acting assistant professor in our Department of Rehabilitation Medicine and a staff physician at the Department of Veterans Affairs. Dr. Sanza's presentation is titled Complementary and Alternative Medicine in Spinal Cord Injury and Disorders. He will be giving his talk first and then open it up to questions when he's finished. So welcome, Dr. Sanza.
Thank you. All right, good evening, everybody. Thanks so much for having me here. If at any point you have trouble hearing me, just feel free to give me a signal and I'll speak up. If you have any questions, we should have plenty of time at the end. So thank you for your time and for inviting me to give this presentation. I will be speaking about complementary and alternative medicine in spinal cord injury and disorders. Just wanted to give you a little bit about background about myself. So I'm trained in physical medicine and rehab, and then a subspecialty trained in spinal cord injury medicine. I do have an interest in this area, although I haven't completed a formal fellowship in integrative medicine. I did some rotations in that field when I was a resident and kind of read about it for fun in my spare time. So we're really excited to put this talk together and hopefully give you a nice review with what's current and what's out there. So some goals and objectives for this talk and some things that we'll be going over today. We'll be talking about some basic definitions with complementary and alternative medicine modalities. I'll be presenting and discussing a few of the more common modalities used, some of the research and evidence for those modalities, some indications and contraindications for them. I was asked to also touch on some of the supplements and vitamins that are often used, and so we'll be talking about a few of those as well. And then towards the end, we'll be talking about some potential challenges and obstacles in using complementary and alternative modalities with any disability or impairment. And so at the end, I definitely invite you and would love to hear your experiences and share your thoughts as healthcare consumers and as patients if you have any experiences, good or bad, with complementary and alternative medicine. So we are all looking for a miracle cure, no matter what ails us, whether it's a spinal cord injury, a chronic illness, acute illness. And so, of course, we want something that's amazing, easy, works quickly, something that's guaranteed. And as we all know, that rarely, if ever, exists. So, I think our role as healthcare practitioners and providers for our patients and for our clients is to really at least be familiar with what's out there and to be able to guide you and advise you on what the current evidence-based medicine is in some of these areas. Because there's rarely, if ever, a panacea for our illness and our disease. So a little introduction about complementary and alternative medicine. So I was kind of looking back at the past lectures with previous forums, and it's been a little bit over 10 years since we had a dedicated lecture in this area. Last was in June of 2005, and so at that time we really focused in three areas, primarily massage, naturopathy, and acupuncture. Since then, over the past decade or so, many of these topics have been covered in other lectures or in other subject areas. So there have been sort of bits and pieces on relaxation, hypnosis. There was a nice talk on medical marijuana usage at the Wellness Summit. So some of the different areas have been covered, but hopefully today we'll give you a nice overview over the research in the past 10 years in some of these areas. When I was putting the talk together and kind of doing my literature review, just for fun, I asked, Dr. Google. I Googled complementary alternative medicine spinal cord injury, and I got over 500,000 results. So as you can imagine, there is a lot out there in terms of what's on the web. And of course, you have to be very careful and cautious with what you read. I went on Google Scholar and used the same search terms and got about 50,000 scholarly articles online. So it's just a huge volume of material out there to sort through. But what is true is that there's not many randomized, double-blinded, controlled studies in these areas. So as we go through the different topics and different modalities for complementary and alternative medicine, you'll see that we still have a lot to learn. So this cartoon, I'm not sure for those of you in the back if you'll be able to read all of it, so I'll just kind of point out the highlights. So there's a lot of different models and sort of examples of complementary and alternative medicine, but this kind of breaks it down into four areas or categories. So for biologically based therapies, that's kind of where the herbals and nutritional supplements fall into. For energy therapies, that's magnet therapy, Reiki therapy, faith healing. Mind-body interventions will encompass yoga, meditation, some acupuncture, acupressure. And then manipulative therapies encompasses massage and chiropractic. And there's a lot of stuff in between. It overlaps. And I think it's a nice cartoon because it kind of keeps traditional Chinese medicine, or TCM, in the center of it all. So we'll talk about a few of these different modalities today. The red letters here indicate what traditionally the conditions that are claimed to be treated by these therapies. So we'll get into that as well. So what are the most common complementary and alternative modalities used among adults in the US? So this is not specific to spinal cord injury and disorders, but this is in general for US adults. And the biggest used modality is natural products. So in that falls herbals, vitamins, minerals, supplements. After that is deep breathing, meditation, chiropractic, massage and yoga, some diet-based therapies, some guided imagery, and other homeopathic treatment. What you'll notice is acupuncture isn't included in here, but I did do some research on that, and acupuncture is used in about 6% of the adult population overall. So it kind of falls in this mid-range as far as modalities that are commonly used. So we'll start off with some just basic definitions. CAM stands for Complementary and Alternative Medicine. It has fallen, I wouldn't say out of favor, but I think the newer term, the more inclusive term, is integrative medicine. But what complementary and alternative medicine refers to is really a diverse group of systems, practices, and products that are not generally considered part of a conventional or traditional medicine. Complementary really refers to using modalities along with or alongside traditional medicine, and alternative modalities refers to using it instead of conventional treatment. So that's kind of a small difference there. Integrative medicine really refers to the practice of this type of medicine, so the field of this medicine, and really using a holistic approach and taking into account the many different facets and aspects of a patient's care, but also with the primary aim of providing appropriate, safe, and evidence-based modalities. I was looking last night on the American Board of Physician Subspecialties, and right now it seems like there's about 26 integrative medicine fellowships around the country. There's one here at Swedish Cherry Hill. Typically they are run through family medicine programs or primary care programs, but really they accept applicants from many different subspecialties, including physical medicine and rehab. So I think it's a growing field of medicine and certainly getting a lot more attention and a lot more funding. You may also hear about naturopathy, homeopathy, and then of course acupuncture, which we'll talk about a little bit more in detail. Homeopathy really refers to more of the herbals and vitamins and supplements, and so a lot of times when folks are talking about homeopathy, that's what they're referring to. Acupuncture is a technique that stems from TCM, or traditional Chinese medicine. And what that does is really trying to realign and re-energize your flow of energy, or qi, to alleviate the symptoms or disease process that you're experiencing. So a little bit of background, just in terms of who is the use of complementary and alternative medicine, and I'll just refer to it as CAM, just to be a little simpler. So there was a survey done in 2006 on patients with multiple sclerosis, cerebral palsy, spinal cord injury, and osteoarthritis. And in that study, it looked at over 800 adults with those conditions. And about 1/5, or about 20% of those patients consulted CAM practitioners or used some sort of complementary and alternative modalities. It definitely was more common in the Western US and more prevalent among women versus men. There was no difference in usage between income groups or insurance types, but it's definitely worth noting that all of these patients did have some form of private insurance coverage. And within those four groups, spinal cord injury patients reported the lowest use among those four diagnostic groups. And so we'll talk a little bit more at the end about why that might be, whether it's access to modalities or physical access to receiving those modalities. looking at the National Center for Complementary and Integrative Health, they did a little bit of a more recent study in 2008, which shows that about 40% of US adults use CAM, and about 12% of kids under 17 use CAM. So I think it's definitely growing over the years, and it's something that we're seeing more and more. As far as conditions commonly treated, it's typically pain, lack of energy, decreased function, and a large percentage, 44% of patients, perceive CAM to be more effective than conventional medicine. A lot of folks, I think, grow increasingly dissatisfied with conventional medicine, or maybe they're not obtaining the results that they want, or maybe they're not lasting as long as they want. So I think there is a lot of benefit to some of these modalities. As far as willingness to use CAM, there was a fairly recent study in Switzerland, specifically in spinal cord injury population. In 2015, this study looked at about 100 patients. It was pretty even split between complete injuries and incomplete injuries. About 33 had tetraplegia, 70 had paraplegia. Data was collected over about 5 months, and almost 75% used some form of CAM since their spinal cord injury. Now, it was a wide array of CAM modalities, but the most common were acupuncture, homeopathy, and the acupuncture was used mostly for pain and spasticity, and the homeopathy was used mostly for UTI treatment or prevention. A fairly decent percentage, about 10 to 20%, used 2 or more forms of CAM. Again, in this study, it was used as a supplement, so complementary rather than exclusively. But most patients had a very high satisfaction with their experience. More recently, just this year, a study at Penn State was looking at comparing the beliefs and practices, comparing SCI patients and their families or caregivers to healthcare professionals, and comparing the beliefs about CAM and the beliefs about 14 different modalities. And they found that spinal cord injury patients and families were much more likely to use and recommend CAM when compared to healthcare practitioners. And the modalities looked at specifically were non-prescription medications, yoga, relaxation, therapeutic touch or Reiki therapy, biofeedback, massage, hypnosis, and acupuncture or acupressure. And there was a positive correlation found between the use of CAM and healthcare satisfaction. So we'll talk a little bit about acupuncture, because I know a lot of folks are interested in that, and I had some questions to kind of focus on this a little bit more. So it's a form of TCM, traditional Chinese medicine. So depending on what you read, it's believed to have originated around 100 BC, but really a lot earlier than that. So it's been used for thousands of years. I did a little research, and it looks like there's some evidence in archaeological studies of the use of sharp stones and or bones for therapeutic purposes as early as 6000 BC. So it's been around for a long, long time. In the US, it sort of came to the popular awareness in the 20th century. A lot of folks attribute President Nixon actually for bringing this to the US. There's a lot of debate about this, of course, but around 1971 or 1972, when he opened up relations with China, had sent a bunch of people over to China for a visit, and apparently one of the journalists got really ill with acute appendicitis and had to be hospitalized, was operated on and hospitalized in China, and then received acupuncture for his post-operative pain and had a really good response to it. So this journalist, James Reston, came back and wrote a big op-ed piece in the New York Times, and since then it kind of flourished in this country. So a lot of people credit sort of that administration for this. So politics aside, it's been around in the US for a while. And basically what it is, and we can talk at the end, and you can share your experiences if you've had acupuncture and sort of what you felt about it, but it involves the insertion of very thin type needles into the skin. It follows certain meridians or pathways of the energy or qi, and there's a lot of different combinations in these meridians and pathways depending on the organ systems involved and depending on what the treatment is trying to address. So the needles are left in for a varying amount of time, but on average about 10 to 20 minutes. They can be enhanced with heat, pressure, or laser light. And most typically, acupuncture is used for low back pain, shoulder pain, and knee pain. It's very frequently used in combination with other approaches as well. So whether it's herbal therapy, acupressure, which is pressure on those same points, cupping therapy, auriculotherapy, or treatment of certain points around the earlobe, and it's often used in adjunct with Western or conventional medicine. So classically, it's done lying supine on a table, whether it's a treatment table or massage table or an examining bed. So obviously, this can pose certain challenges depending on the way in which you transfer. But it can also be done in a seated or reclined position. And so there is a model for acupuncture called community acupuncture, which is done in groups. And so it's typically done in a big open room, much like this one, where patients sit in sort of a recliner chair, kind of a lazy boy style chair, or alternately in your wheelchair, or especially if you have a tilt and space power chair. It's a very similar position. So the treatments can be done, and they're typically focused more on treating points in the limbs. So whether it's the arms or legs, so it doesn't require that you get fully undressed or transferred to a table in the supine position. So that's a model which is, I think, very nice for patients with spinal cord injury. We'll talk a little bit about risks, especially with spinal cord injury with acupuncture. So obviously, depending on your level and completeness of injury, sensation or lack of sensation could be an issue. This is kind of a cartoon of the needles here. So whether that causes pain or discomfort or not, hyperesthesia or not. It may trigger autonomic dysreflexia if it's perceived as a noxious stimulus. It may cause, depending on some of the points, it may potentiate or make worse low blood pressure or orthostatic hypotension. It could cause issues with temperature dysregulation or skin integrity. So a lot of considerations. So there are lots of studies out there for acupuncture. Most of them are related to the treatment of pain. And I won't necessarily read through all of these for you, but so, there's many studies out there, many years, in spinal cord injury specifically. So there are some improvements with pain intensity, and depending on if it was used with acupuncture or with chiropractic, different levels of effectiveness. Most commonly, and probably the best study is in spinal cord, is for the use of shoulder pain. So this is just a kind of a cartoon of an example of some of the meridians and some of the points that might be targeted for shoulder pain. So shoulder pain, as you probably are well aware, is a very large and common problem for our spinal cord injury patients, especially those with chronic spinal cord injury, due to overuse, trauma. Most commonly, we see rotator cuff injuries or impingement. So this study, although it is a little bit old, showed that acupuncture treatments are effective for treating chronic shoulder pain and for improving functional activity in persons with spinal cord injury. Some other areas that acupuncture has been looked at is use for neurogenic bladder. So one area that was looked at was the role of acupuncture in chronic urinary retention. And so there was a small analysis of 3 randomized controlled trials looking at this, and it looked at acupuncture in combination with traditional rehab training, whether that was better than rehab training alone. And then it looked at acupuncture and aseptic intermittent cath, and whether that was better than cath alone. And the conclusion was that it may have a potential, acupuncture may have a potential effect as a complementary therapy in chronic urinary retention. So not a strong endorsement for it by any means, but it may have a beneficial effect in chronic urinary retention. There was a study by Dr. Wong looking at neurogenic bowel. This study, which we'll talk about in a couple slides, was actually a study looking at neurorecovery in spinal cord injury. But one of the findings that they did see was that there was a statistically significant improvement in bowel FIM scores 1 year post-injury for the subjects who received the acupuncture. So there's been some attention to acupuncture and its role in osteoporosis and bone health. Basically, the standard therapy was compared to standard plus acupuncture, and bone mineral density and inflammatory markers were looked at, but there were no statistically significant findings in this study. So probably a lot more research and a lot more to come in this area. In terms of neurorecovery in spinal cord injury, acupuncture has been looked at. Back in 2003, Dr. Alice Wong did a study looking at traumatic spinal cord injury patients for ASIA class A and B, doing auricular point therapy, which again is around the ear. And she found that sensory and motor skills improved in patients who completed the regimen of Oriental medicine of this auricular acupuncture, but they were also getting massage and physical therapy. And this was compared to standard rehab care alone. And so she found improvements in motor, sensory, pinprick scores, and FIM scores. So her conclusion was that the use of concomitant acupuncture therapy, when implemented early, can contribute to significant neurologic and functional recoveries. But it was not a double-blind controlled study, not randomized subjects, so there were some limitations with that study. There was a systematic review in 2015 looking at a similar thing in terms of acupuncture and neurorecovery with spinal cord injury. This included 12 different randomized control studies. And again, the conclusion was that it may have a beneficial effect on neurologic recovery, motor function, and functional recovery. The studies were not great, so basically the conclusion is that we need more studies to take a look at this. So I'm sure we'll be seeing a lot more of this in the near future. So some possible mechanisms or theories about why acupuncture might help with neurorecovery basically is decreasing the acute inflammatory response. So not to get into the nitty-gritty science of it all, but you know, there's a lot of acute inflammatory markers in the time of spinal cord injury, and so the thought is that this might somehow mitigate that inflammatory response. So of course, while modalities may have their benefits, a lot of them may have adverse effects too and side effects. And so acupuncture is generally considered relatively safe and pain-free, but there are possible adverse effects. So looking through the literature and doing my review, there were some case reports of direct spinal cord injury and nerve root injury, although typically acupuncture is very superficial and doesn't go that deep. Abscesses, infection, bruising, again, pain if you have sensation. There was one case report I came across that I thought was really interesting about one patient who actually had a spinal epidural hematoma that was thought to be secondary to the acupuncture treatment. But it was thought that this was due to bleeding of the veins in the epidural space. But again, there have been a few cases documented of this type of thing, but it's very, very rare when you think about the overall number of people who get acupuncture treatments. So as far as considerations for acupuncture, so definitely it's something to consider. I think it's something that patients ask about a lot and more lately. I think it can be very useful to improve pain, especially some of those targeted musculoskeletal pain conditions we talked about. As far as effect on motor and sensory function, bowel and bladder function, and neurorecovery, I think the jury is still out on that. But it is fairly low risk, essentially low or no risk. One thing to consider is that the type of acupuncture may vary widely, so there's no consistent prescription for the points or the meridians used. Also, the training of acupuncture providers can vary as well. So some providers are trained in Oriental medicine. Some Western medicine providers get trained in different courses that are available around the country that are a little bit shorter. So there might be some variations in approaches of acupuncture as well. So switching gears a little bit to the manipulative therapy modalities, we'll talk a little bit about massage. So I think a lot of patients love massage. I love massage as well. I think it's great. And it's used for a wide variety of conditions as well. So typically for pain, spasticity, stress management, different kinds of sports injuries. Again, a lot of variation and approaches in terms of practitioners and styles and types of massage. It can be part of a more traditional therapeutic approach with either physical or occupational therapy as well. There are some access issues in terms of availability and cost, and also access issues related to finding a practice that might be wheelchair accessible or being able to get on a massage table depending on how you transfer. So there were some studies looking at massage therapy in spinal cord injury during inpatient rehab. So this was actually an interesting study where the rehab nurses were trained on a type of massage called BCM, or sports massage. And so what that is a very kind of slow and rhythmic compression into the muscle groups, and to create blood flow and create what's called a hyperemia, sort of a warming blood flow in those areas, and to soften the tissues. And so this study had the rehab nurses trained in this form, and then they randomized the groups, and the nurses performed 20-minute treatments, 6 sessions over 2 weeks, and then they looked at some outcome measures, including pain intensity, fatigue, and depression. And the only statistically significant finding that they had was in one of the depression outcome measures. So I don't think it really showed what they were hoping it to show, but it did help with one of the mental health outcome measures that they looked at. So of course, nothing is without potential adverse effects, and so there have been some adverse effects in the literature for massage with spinal cord injury. So there was a systematic review done in 2014, looked at about 30 articles, and they found some disc herniation, soft tissue trauma, bone fracture, hematomas, pain. Spinal manipulation specifically has been associated with the most serious adverse effects. But overall, again, when you think about the number of people getting massage therapy, the incidence of these events is very, very low. And most of the patients who experienced some of these side effects experienced a full recovery. And this was in 2014 was this review. So moving to the mind-body intervention, we'll talk a little bit about yoga. So yoga is a CAM modality which encompasses meditation, relaxation, breathing control, and a variety of postures and postural control. So specifically, there was this gentleman named B.K. Iyengar who developed a form of yoga, a form of hatha yoga called Iyengar yoga, which really focuses on strength and flexibility and physical balance in the form of postural control and breath control. So it really focuses on alignment, sequencing, and timing. And this is the form of yoga that, in looking through the literature and kind of researching for this talk, I found seems the most compatible with a seated or wheelchair level approach of yoga. And so this, you may see this commonly as far as a specific type of yoga used. There is some evidence behind this type of yoga with Iyengar. So this is really recent from this year in 2017. There was a small pilot study looking at, again, a small group of individuals, but they received this Iyengar yoga twice a week for 6 weeks at a seated program. And they did find some reduction in depression, greater amounts of mindfulness, greater levels of connectedness and purpose, and acceptance to one's body after spinal cord injury. So I think there's a lot of potential there. There was one case report I came across from 2015 looking at a 59-year-old patient with incomplete cervical tetraplegia. So this patient was already ambulatory with an assistive device, but did practice yoga for 60-minute sessions twice a week for 12 weeks. And there was a lot of improvements noticed in terms of balance, endurance, flexibility, posture, some muscle strengthening improvement, and overall performance of functional goals. So these are just some pictures kind of showing some potential adaptations for yoga at a seated level. So using blocks to kind of improve some of the positioning if you can't reach to the floor. Most of the models and programs I came across had another person usually behind helping with postural control or positioning. So we see another kind of person here behind helping with some of the postural positioning. And so this is just another demonstration here of some adaptive yoga. This is still seated but on the floor here, obviously using some blocks and some blankets for positioning, a spotter for some postural control. So I think this could be a really great modality. I know a lot of centers have this type of program for adaptive yoga, so I think it can be a really nice complementary and alternative modality. All right. This particular picture actually is from when I was working in New England at one of the centers in the Boston Metro West area that had this program. So. Other types of complementary and alternative modalities, we touched on these kind of at the beginning, but meditation, biofeedback, hypnosis, healing touch, Reiki therapy, or otherwise sometimes known as laying on of hands, Qigong therapy, which is similar to kind of yoga and Tai Chi. It's also a gentle form of exercise using repetitive movements, coordinated body posture movements, and breathing and meditation. And then, of course, chiropractic. It's probably a separate talk in and of itself, but I think a lot of folks ask about that as well. So I was asked to talk about some vitamins and supplements specifically that a lot of folks use. So we'll kind of switch gears a little bit to that area. And do vitamins or supplements help prevent UTIs? So I was asked to talk about this a little bit, so hopefully I'll shed some light on that topic. But first, we'll talk just kind of in general about natural products and what's used most by U.S. adults. So the most common, and this is from 2015 data, so the most common supplement used at that time was fish oil. So fish oil, omega-3s, fatty acids, followed by glucosamine and chondroitin. Then probiotics or prebiotics, melatonin, coenzyme Q, echinacea, cranberry, garlic, and ginseng. So these are kind of the most common things that are used by U.S. adults. So cranberry. So this is a VA study actually done in 2008 looking at cranberry in terms of preventing UTIs, whether or not it's helpful. And so the thought is that the cranberry would acidify the urine and reduce the proliferation of bacteria. But there really wasn't any consensus on the amount, so whether it was the amount of tablets or the amount of juice, the dosing, et cetera. And of course, you have to be cautious if there are other medical issues to consider, such as diabetes, obesity, or other medications that might interact. But this VA study looked at the prevention of UTIs and STIs specifically with neurogenic bladder. And they found the frequency of UTIs were reduced about 30%. And the patients that received the most benefits were those with a high GFR, or what we call glomerular filtration rate of the kidney. So their overall conclusion was that cranberry tablets should be considered, but it wasn't a strong recommendation to use that. There was another review in 2016, much larger retrospective review of over 40,000 patients. Really, there is not much evidence-based support out there for the use of cranberry in UTI prevention. So D-mannose, that's another one that I was asked to comment on. And so it's a naturally occurring sugar, very similar to glucose, largely excreted in the urine. And it doesn't kill bacteria, but the way it works is it sort of dislodges or displaces them. Specifically with E. coli, which, as you may know, is a pretty common pathogen. So the D-mannose will concentrate in the urine and sort of dislodge or displace the bacteria from the bladder wall. The evidence is pretty weak, though, I will say. It's old studies in the 80s, mostly done on animals. Although the levels of bacteria were lower within that first day, overall, it didn't really affect anything else. And so hasn't really been proven or studied in people. Vitamin C. A lot of folks take vitamin C, especially this time of year, right? So trying to bump up our immune system. So a lot of folks use vitamin C also for UTIs or to prevent UTIs. But so far, as long as I could find, and in 2013, there was a big review in the Canadian Urological Association Journal. There's no clinical studies which demonstrate the effectiveness of vitamin C in improving symptoms or UTIs. So Cystex, I was asked to talk a little bit about Cystex. And so although I wasn't familiar with that brand name, basically it's the components of Cystex is twofold. So it's an analgesic and an antibacterial agent. So the analgesic is a sodium salicylate, and the antibacterial part is methenamine. So methenamine, probably many of you have heard of. I know a lot of patients who take methenamine, basically it metabolizes in the urine to create an ammonia or formaldehyde type product. So it's antimicrobial, it failed to show a significant effect for UTI prevention. So at this time, it's not formally recommended for UTI prevention either. Although I will say anecdotally that some patients swear by it. So I think you have to see kind of what works for the individual. So probiotics. So that is kind of becoming very, very popular, I think, lately in the media and online as well. So many of you may take probiotics. You may be familiar with probiotics. So they're live microorganisms, sort of the good bacteria, the helpful bacteria, thought to be really helpful in the digestive system to restore a healthy balance in your gut, to boost your immune system, and to kind of overall help with your bowels and with your healthy gut. So most common strains I listed there, the Bifidobacterium and the Lactobacillus. Most commonly, people think of yogurt or fermented foods. If you're buying commercial products, just looking for this live and active culture seal. So the thought is that it restores the balance in your system and decreases the overgrowth of the bad bacteria or the pathogenic organisms. So there's a lot of attention, I would say, and a lot of press and media and internet presence of this new sort of gut, microbe, brain, skin axis, and sort of, the gut as our second brain and this kind of thing. So there's a lot out there. Just kind of caution you to kind of be careful what you read online. But in terms of probiotics and the role in neurogenic bowel, really there hasn't been a whole lot out there that's been demonstrated. There's some research that shows that it can affect gastrointestinal transit time, particularly in the large bowel. It has been shown to reduce antibiotic-associated diarrhea, again, just by restoring that healthy gut flora and the good bacteria. It is generally considered to be safe, so there don't seem to be a whole lot of drawbacks for using probiotics. As far as specifically as a treatment for spinal cord injury, there was a study in 2016 looking at what's called gut dysbiosis. And dysbiosis basically is a phenomenon of disruption when the good bacteria are depleted or overrun by the bad bacteria. And so there's some thought that with spinal cord injury, maybe the time of that acute injury will disrupt the microbiome in the gut and the healthy bacteria. And so these probiotics might restore the balance and actually boost some neuronal regrowth or spinal cord recovery by rebalancing the system. So that's kind of all theoretical. There hasn't really been certainly no formal evidence-based recommendations for probiotics in terms of spinal cord recovery. But I think many folks use it, especially when they take antibiotics. There are some animal studies out there, just to point out, as far as probiotics and recovery of motor function, locomotor function. So this was a study that looked at really, really high doses of probiotic administration. So in this study, they treated mice with 225 to 900 billion bacteria per serving. So just to give you sort of a frame of reference, probiotics are usually dosed in CFUs, or colony-forming units, and kind of an average dose for an adult will be 1 to 20 billion CFUs per day, and these mice got 225 to 900 billion. So very, very high doses. And there was some evidence that showed that the probiotics may suppress inflammation and biochemical damage to the spinal cord after injury. And some of these mice showed less spinal cord damage and were able to regain a little bit of hind limb movement after this high dose administration. But again, this is studied in mice, not at all proven or studied in humans as of yet. So one of my colleagues talked about some complementary and alternative modalities a while back and sort of made me aware of turmeric, which seems to be kind of very popular, I think, also in the media and in the literature right now as sort of a cure-all for everything, sort of an anti-inflammatory supplement. And so it is thought to have anti-inflammatory and anti-cancer properties. There was one study in 2016 which looked at turmeric in terms of reducing some free radical damage in the spinal cord. And there are some animal studies showing that curcumin, which is the active ingredient in turmeric, improves some neurologic recovery after spinal cord injury. But again, this is all kind of animal-based studies, but sort of a sign of things to come, I think, in terms of research areas. In terms of emerging areas for UTI prevention, bladder Botox is being looked at in terms of reducing UTIs, and also bacterial interference, or intentional bacterial colonization, to again sort of rebalance the bacteria in the bladder. So medical cannabis, we get a lot of questions about this. So I have to be a little bit careful as a VA doctor here because it's not yet approved on the federal system. So where I work on our campus, it is not legal, but as you know, in many states it is. And so many of our patients ask about it, ask if they can get it, and I think use it for treatment of pain and spasticity. And it's used in a lot of medical conditions, especially for appetite with cancer and HIV patients, and palliative care as well. So it's been around a long, long time. It's used for a variety of indications, so for analgesia, for anticonvulsant effects, antispasm effects. And of course, there's a lot of legal and financial considerations and implications to think about. You know, personally, all that I ask is for my patients to kind of be honest with me and tell me if they're using it or not, so that we can incorporate that into our treatment algorithm if we're using traditional medications as well. So in terms of medical studies and evidence out there, in the Journal of Alternative and Complementary Medicine in 2017, there was a study looking at how medical cannabis was used in persons living with different chronic conditions or illnesses. So they looked at rheumatoid arthritis, Crohn's disease, spinal cord injury, and cancer. And the medical cannabis was used either as an alternative to prescription or over-the-counter medications, as a complementary use with medications, or as a means of tapering off the prescription medications. And basically what they found was that it can be used to taper off prescription medications, and it's a good complement to prescription medications for symptom management, and it can help alleviate a lot of the medication side effects that you can otherwise see. So again, kind of pointing to the adjunct use. Now, I will point out that when I was reviewing the prior SCI forums and lectures and programs done here at University of Washington, Dr. Carter did a great talk on the use of medical marijuana to manage symptoms in spinal cord injury. This was back in 2014 in the Wellness Summit, and so that's available, I believe, online to view that lecture. So the most recent sort of thing published in this area is just this year in January in 2017 by the National Academies of Science, Engineering, and Medicine. They looked at over 10,000 articles and abstracts since 1999, looking at the health effects of cannabis, and sort of came up with current recommendations and evidence in this area. So they arrived at a lot of different conclusions for a lot of different indications and medical conditions. But as far as spinal cord injury goes, because that's what we're talking about today, there was insufficient or no evidence to support or refute that cannabis or cannabinoids are an effective treatment for symptoms of spasticity in patients with spinal cord injury. So, you know, again, anecdotally, a lot of patients use it, a lot of patients tell me it works. But there was no evidence to either support or refute that claim. So other things that I think are coming in vogue in terms of what patients are trialing and what you read online, there's a lot of attention on alternative diets and sort of anti-inflammatory diets, kind of all following the same philosophy of reduction of the inflammatory state in your body. And so we may be seeing more of that in research as well in terms of how that can affect the nervous system and the immune system. So overall, I think, you know, with complementary and alternative medicine, there's a lot of advantages to it. You can definitely use it as part of your treatment program to minimize some of the pharmacologic and sort of traditional medications that we use, and certainly trying to minimize some of the side effects that we see. It's nice because if you can access it and you have the resources to use these modalities, you can get these treatments more frequently and perhaps use them for maintenance for longer periods of time. And also, I think the CAM modalities can be used sometimes to defer or delay otherwise some surgical interventions and some postoperative dependence. So I think about musculoskeletal conditions, whether it's rotator cuff or carpal tunnel. You know, if we can find a way to prolong or delay surgery a little bit longer by using some of these modalities, it would make the patient and our client more independent for longer, and it would prevent them from being in the hospital for a prolonged postoperative recovery period. Also, I think with CAM modalities, it really engages the patient and the client into the process and really makes them more of an active participant in the healing process. And I think that's a really huge part of the psychological healing that takes place. So I think folks can feel a lot more part of the process and really be an active participant in their care. Barriers and challenges. Certainly we touched on a couple of these already. So whether it's geographical or structural access issues in terms of getting into a building or office or getting into a practice, transferring to or from a table or a chair to get your treatment, whether you can receive the treatment or modality at a seated level or whether you have to be supine. Cost is a huge barrier, I think, in this area. A lot of these modalities may not be covered by insurance programs. Whether or not you have access to public or government programs that cover these modalities will vary widely as well. And then whether or not a patient or client can pay privately for these modalities. So that's going to, I think, play a really big role in how frequently you'll be able to use these. And then also providers. We can be a barrier, certainly. I think providers, just their unfamiliarity with the subject matter with some of these modalities, maybe the lack of support, maybe there's not a philosophical or ideological congruence with some of these modalities. And so sometimes really aligning yourself with a healthcare provider who shares a similar belief structure and shares a similar approach to some of these modalities is really helpful. Someone who's willing to work with you in terms of problem solving and coming up with some alternative or complementary techniques to treat your symptoms. I think the stigma and the skepticism of CAM really depends largely on where you are. Certainly here on the West Coast, I think people are much more receptive to it. But I think it's emerging all over the country and certainly all over the world. And I think that's becoming less and less of an issue, in my opinion. So in terms of cost, just to touch on that just a little bit. So healthcare costs are huge. So I was looking at the national health expenditure data, most recently what I could find for 2012 anyway. So about $2.5 trillion in terms of reimbursement. But if you see here, so physician visits are about $50 billion. Complementary practitioner visits are about $15 billion. So it's definitely a sizable amount of money in terms of healthcare dollars. Prescription drugs are $54 billion. And then natural products are about 13. There's sort of this catch-all of self-care purchases, so that can include a lot of different things, but some of the private pay money that you'd pay for CAM modalities falls into this area. That's about $3 billion, and conventional out-of-pocket expenses here. So it's a lot of money. It's big business, and so you have to really, I think, be cautious about what you read and sort of what you believe, because of course, every company, every manufacturer is going to probably advertise that their product is the best and that miracle cure that we're all looking for. So local resources, and so hopefully members of the audience, feel free to chime in. Let me know if you have other things we can add to this list. I just put a few of them up there. Here in Seattle, there's a lot of resources here locally. So whether it's Seattle Integrated Medicine, Bastyr College, Evergreen, there's a lot of resources nationally and online as well. So I think the University of Alabama Model Systems Network has a really good section on their webpage. If you go to health management section for complementary and alternative modalities, there's a lot of different subject areas that are separated out, and so you can look them up individually, whether it's just a general overview, medical marijuana, hypnosis, acupuncture, aromatherapy, massage, meditation, herbals, and spirituality. So a lot of good resources there as well. And then of course there's some larger national organizations and online resources. PVA is the one I'm most familiar with given my work setting, but there's Christopher and Dana Ree Foundation has a lot of good things on their website too. There's the International Association of Yoga Therapists has a lot of links to adaptive yoga. National Center on Health, Physical Activity, and Disability, National Center for Complementary and Integrative Health. So a lot of good resources and availability online of information. So that's what I have. I hope that gave you kind of a good overview of sort of what's out there now in terms of complementary and alternative modalities. I think this is a field that's changing all the time, and I think I personally find it really interesting to read up on it and kind of keep up on it. And sort of learn about the changes as far as what's out there, and certainly for our population to try to really come up with a multimodal approach to healthcare. So
let's open it up for questions. What questions do people have?
And if I don't know the answer, I will try to look it up and get back to you. Or you can email me, and I'm happy to correspond and try to look up answers to any questions you might have.
So my question is, on so many of the things that don't have either, it'll say, there's no studies that say that this is worthwhile or not. Is most of that because spinal cord injuries are a relatively small population and they just don't spend the time to do the research on various things?
I think that might be a large part of it. So, the rehab field in general is relatively new in sort of the grand scheme of medical fields, and certainly spinal cord injury is a smaller population. So we may just not have as much research dollars or healthcare dollars to look at some of these areas. I would say that I think you can find probably studies or some research or some case report to support or refute anything, or most things. So I'm a big believer in finding what works for the individual and for the patient in front of you. I do have patients that swear by methenamine or swear by cranberry or firmly believe that the probiotics help their bowel program. And so I think, great, if there's no adverse effects and no interactions with those other medications and they can obtain those products, it's not causing them any harm, it's working for them, I think great, even if the research doesn't show that. So I think it can be a very individualized experience for sure. It may just be that the research is not out there yet,
I have a question about how would people know how to do like a personal experiment for some of this stuff, because I think it's very true that people want to try things, and I think it's great. But I mean, you as a physician, what do you recommend to people when they're thinking about, like, I'm going to give cranberry a try, or I'm going to give this other thing a try, because none of it's inexpensive completely.
Right.
So do you kind of have a recommendation about how people can do at least a mini experiment on themselves?
Yeah, I mean, I think so. Using cranberry as an example, because a lot of our patients will ask about that. So, you know, I look at potential interactions with other medications. So making sure, you know, first rule, do no harm, and then depending on other medical conditions or comorbidities. For example, if they have diabetes, let's say, I don't think it's a good idea to be drinking tons of full-strength cranberry juice, right? Because we could really be exacerbating the diabetes. So like looking at those types of issues, whether we need to dilute it, whether they want to do a tablet, you know, those kind of things. You know, for probiotics, I think those are fairly benign, so doing a trial of that, you know, being able to buy those if you can afford to buy them over the counter, that's great. Again, working at the VA, we have the luxury of providing, you know, some of these supplements and being able to get them through our pharmacy, but some patients may have to private pay or purchase them over the counter. So I think doing a trial, definitely informing your provider if you're doing this on your own, just to make sure that it doesn't interact or interfere with other medications. And then I think reporting back is really important, just to close that loop and see, you know, did it help, did it not help? If there's no difference, no improvement, then why waste the money? But if it does help, I think it's important to get that feedback and also to give it a fair trial, you know, an adequate amount of time.
All right, so join me in thanking him to joining us tonight.
Thank you.